everybody. Welcome back to the Tooth Be Told podcast. My name is Brandy, and I just wanted to come on here really quickly because I had a question from a viewer, and her question was specifically about Sjögren's syndrome. So I took some notes. So if I'm looking down, I'm just referring to the notes to make sure I hit all the points I want to hit. But first, I just want to talk about Sjögren's and what it is. So Sjögren's is an autoimmune disease, and it makes your glands produce less moisture than they should. And it's primarily identified by its two major symptoms. So that's dry eye and dry mouth. Um, so some oral manifestations or symptoms of Sjögren's are halitosis, aka bad breath, frequent sore throats. You can also have an increased risk for cavities, as well as tooth loss and infections inside the mouth. Also, you could have oral candiditis or thrush, as it's known, enlarged salivary glands, mouth sores, chapped lips. Um, Also, you may find it hard to chew or swallow. So that may become difficult because the mouth is dry, and it can also affect the way you taste food. So if you're having issues chewing or swallowing, you may also find that you have some minor digestive issues as well. Because your mouth is the first place you digest food, it can be difficult to digest later if you're not chewing properly or if you're having a difficult time swallowing. This disease affects about 1 to 4 million people in the United States. And that's primarily over all races and ethnicities. So, it pretty much affects people equally across the board, no matter what your race or ethnicity is. However, it is more likely, 9 times more likely to be exact, to be diagnosed in women than it is in men. So women will typically have this disorder. Um, so the reason why you can have issues inside the mouth is because when you have decreased saliva, you can have a lot more plaque buildup than you would normally have, and that can cause cavities. So the saliva, it has several functions inside the mouth. So it will help to neutralize acids, and it also helps to wash away food particles. So if you don't have those things, the food particles will stay there, which turns into plaque, and it can sit there, and that's what can cause cavities. What can you do if you have children? So first and foremost, just let your dentist know, because sometimes they can prescribe a prescription strength mouth rinse, or also, which is really the same thing, but also like a artificial saliva, which is the mouth rinse that you would use. Um, they can also prescribe to you prescription strength um, fluoride toothpaste. So it's going to have a higher concentration of fluoride than your um, toothpaste that you find in the store. So that would be, they can also do that. You got to visit your dentist for regular checkup and cleanings, like every 6 months. The more frequently and often you're there, the less likely you are to have anything that goes unnoticed. So if you're coming every 6 months, you're going to be not only getting your teeth cleaned, helping to get the plaque off, but also having the doctor do an exam, checking for cavities. If you do have any cavities, catching them early so that there's no major issues. So that would be good. Also, you can use a fluoride mouth rinse before bed. So the one that I usually prescribe to my patients is ACT, or I believe Listerine has one. It's a purple color, but there's no alcohol in it. It's just a basic fluoride rinse. Fluoride rinses are done best before bedtime. So after you floss, after you brush, right before you go to sleep, swish with the mouth rinse for as long as it tells you on the bottle that you have. And then nothing else to eat or drink, no water. You just want to kind of let the fluoride sit there so that it penetrates the enamel overnight. And then if you do have Sjögrens after meals, you should be rinsing with water. So those particles that your saliva would normally wash away for you, you rinsing with water, that will help to wash away. And use lip balm, use your chapstick, because your lips can get chapped, they can get dry because your mouth is dry. So there you have it in a nutshell. That's for you, Miss Rachel. If you guys have any other questions, inquiries, if you want to know about dental insurance, you have a question about a procedure, what steps you need to follow, if you're interested in braces or Invisalign, or if you need to have a root canal or implant, veneers, crowns, bridges, deep cleanings or scalings, osseous surgery, anything that you need to have done. If you guys have questions about the steps or what it's about, I can just come on briefly for a few minutes and explain it, give you an overview. And you guys can ask questions in the comments. You can also go to the website, toothbetoldpodcast.com. And if you go to the, I think it's Contact Us page, which is the third page, right? If you scroll right past the audio versions of the podcast, there'll be like a little inquiry page where you can leave your question, you can leave your email, and I'll read it over and get back with you. Or you can just email us at toothbetoldpodcast@gmail.com. Leave us comments in our socials, Instagram, Facebook. And actually, if you leave comments in Instagram, if you leave questions in comments on Instagram or YouTube, I'll be able to get them as well. Facebook, not so much, because Erica is in control of that. I don't have access to it, but yeah, I'll figure it out at some point and get that taken care of. But yes, so guys, if you have any questions, please, please, please subscribe, like, share, follow, and I look forward to seeing you guys on the next podcast. Take care.